questions towards the end. So welcome, and I will also say that we'll be recording, and with your permission, we'll put the recording on our website. We tend to have a lot more folks who watch after the fact and who are able to attend in real time, especially in this day of Zoom overload. So welcome to all who are attending. To those who don't know me, I'm Megan Ranney. I am an emergency physician, director of the Brown Lifespan Center for Digital Health, and academic dean at the School of Public Health here at Brown University. And I'm so excited to welcome you all to this week's seminar from the Brown Lifespan Center for Digital Health. Our center is a collaboration between the medical school and Lifespan, our healthcare system, dedicated to creating, validating, and disseminating digital health interventions that make a difference for patients and populations. Really what distinguishes us is the focus on both evidence and equity, making sure that what we're doing really works for our patients and for the larger community. And a big part of that work is things like this seminar series, creating opportunities for us to exchange ideas and hear from great innovators across the country and across the world. And that's why I'm so excited today to welcome the folks from Project Sunshine. I got to know Project Sunshine through Robin Wachtler, who is a Brown affiliated kind of alum and parent a couple of years ago, and was just so impressed by their work. I know that they will talk about in detail. Project Sunshine is a 20-plus-year-old international nonprofit that harnesses the healing power of play to serve children undergoing serious medical challenges. And today they're going to talk a little bit about a program that they developed during COVID to deliver child life and child play through a HIPPA-compliant Zoom platform. The speakers today, very briefly, Dr. Bernie Rosoff, who I actually know through work that we do around firearm injury, is a supporter and board member of Project Sunshine, as well as chair of the organization's program committee. He's also just a super cool person, and so you should look him up if you're interested. Whitney Nam-Pollock has been the executive director of Project Sunshine since 2018 and has been doing incredible work at mission-driven organizations and nonprofits for 25 years. Meg Kellett is the director of pediatric experience at Project Sunshine and oversees national programs and nonprofit as well as medical facility partnerships. I know she'll talk a little about that. And finally, Kira Hugh is a program coordinator on the pediatric experience team at Project Sunshine and is really one of the leaders of programs such as TelePlay. And so I'm so thrilled to welcome the four of you and Robin to join us today. I will mute myself. I will invite you all to speak for as long as you want. I encourage you to stop, 10 or 15 minutes early so that we can open things up for questions, which the amazing Allison Seeley, who is our education coordinator at the Center for Digital Health, Allison will moderate our questions at the end. So Bernie, Whitney, Kira, and Meg, take it away. Thank you for joining us.
Thank you. Thanks, Megan. And while Kira gets the deck up, we have a little presentation. I want to mention she's Brown 21, so we are, yeah. So that was just a happy coincidence. Maybe not a coincidence because you all train very hardworking, smart people and we hire. So we're going to take you through, and Meg, Kira, Bernie, and I are all going to speak, but we're going to take you through a little bit around our new innovation, which is TelePlay, tell you a little bit about how we got there, what we're doing, and why. And in the discussion point, we would love to hear from this center's community in hopes that we can potentially collaborate around some research. And so that would be one of the things that we would love to talk with you all about. We want your advice, we want your feedback. And if you can, nudge us and help make us better, that is great. Even if we walk away and there's, no one interested in further conversations, that's okay. Just raising awareness and getting your advice in this hour would be really helpful. But if there is someone who's listening and thinking and maybe would want to talk with us further or get more involved, we would love to have you. So what you're about to see is a culmination of about 2 years of work. And it includes a literature review, a visioning exercise, monthly meetings with technologists and doctors and experts, and a very passionate team. And we really see a future of bringing more joy and play to families, and families who have a child who have a medical challenge. We serve every child with a medical challenge, doesn't matter what the challenge is. It could be acute, episodic, chronic. We know that there's a strong power of play and how it heals, and we'll talk more about that. So we're here to tell you a little bit more about what we do and to create and how we're creating peer-to-peer connections through free and developmentally appropriate virtual play. So we'll go to the next slide. So every year we're going to talk about numbers, and that's really important. But and I know that a lot of the folks around the table talk a lot about numbers and also work with real people in the emergency departments and other parts of the healthcare world. But every year, I just want to remind everyone that as we're talking about numbers and people, every year there's millions of real families who are going through a traumatic experience, or even just an uncomfortable and difficult experience. It doesn't have to be traumatic, of having a child face an illness, be hospitalized, or deal with some sort of chronic issue. And doing this during a pandemic is even harder. So that pain is real. And maybe some of you are going through that right now, or have as a child, or are doing that as a parent. So it's a real challenge that is happening in millions of households, but Project Sunshine is part of the solution. And that's why we're here. So we deliver play and joy to pediatric families. So just to give you a little bit of a sense of who we are, Megan mentioned it, been around since 1999. In pre-pandemic year, 2019, our last full pre-pandemic year, we served 200,000 children and families. We have a network of 20,000 volunteers. We're in 5 countries, and we are partnering with 450 medical centers, and some in that is included in nonprofits, which we can talk a little bit more about. Every part of what we do in our service includes volunteers. So we have our primary mission of delivering play and activities to children and families, but a secondary mission of providing local service opportunities to people who want to give back to communities. So we can't do Project Sunshine programs without partners. It needs a volunteer and it needs a partner. So the partners, and so we partner with, as I mentioned, 450, but this is just a sample of some of the hospitals that we are involved with. And we rely on partners and volunteers to deliver the programs. So I want you to keep that in mind because it's core to our structure and our success, and it's part of our future. So what do? Well, we play together. That's a big part of it. That's a distinction than just play independently. So it's volunteers playing with a child or multiple children together. And the together, we mean what we say. It's connection and interaction. And when we do this playing, broadly speaking, pre-pandemic, we've done it through activity kits, which you can see with that little girl holding the yellow bag. Those are curated by our child life specialists to have therapeutic value, and they're given to hospitals so that children can have something to do or to distract them while they're waiting for a procedure, recovering, et cetera. And then the other program that we do, we call in-person play at partner facilities. Those are the traditional bedside volunteering, as you can see with that volunteer in the lower corner. So why play? So those are our 2 legacy programs. We'll tell you about our new program, TelePlay. But why play? Well, it's essential to childhood development, and having that continuity of play when you're facing a medical challenge is really important to healing. So over this past, what is now shockingly almost 2 years, the more we learned about how much and how long those mental health consequences of the pandemic are going to persist in millions of young people, the more we understood our role in moving forward. So we can step in at Project Sunshine to provide that continued connection and play and community for patients and families. And we know that it's that play and connection that help young people grow, learn, and heal. And it's really essential when you're managing anxiety and isolation. Children with chronic conditions miss an average of 29 school days per hospitalization, and that reduces their opportunities for time for learning. And just as importantly, can impact their socio-emotional development as well. Trauma at this fragile developmental stage can continue to affect kids across their life. And some of you probably know this more deeply than we do. You may be studying it, but they face lower academic achievement, increased disability, and fewer job opportunities. So it really is a pervasive issue in our country and in the other countries we serve. So we in 2019, just to give you a breakout of our numbers, we served just close to 200,000. 66,000 was in person, and that's within bedside visits or events at hospitals, and then 130,000 were served through activity kits that were created by child life specialists, assembled by volunteers, and delivered for free to hospitals. So that's what we looked like, a little bit more detail in 2019. And then in 2020, of course, our mission was stalled because we were in hospital. We were delivering in hospital, but in the lockdown, all volunteers were paused, and that left with our families and our partners without access to our in-person services. Our activity kits, the demand increased by 1,000-fold because playrooms and other socialization was stopped. But it is that in-person volunteering that's really in our DNA, that connection. It really creates impact. So TelePlay was something that we quickly invented, and we did this over started within the first 10 days of the pandemic. And I'll tell you a little bit more about that timeline. But first, I'll give you sort of the headline of what it does. Well, in 2021, we served 3,000 children. So that is about, if you think about that, it's about 12% of our best year of in-person activity in 2015. So that's not bad for new adoption of a new program. We also reduced anxiety by 31%. And we'll tell you more about how we did that. We also, through TelePlay, created 700 new volunteer opportunities. And we had a growth of 30% of our medical partners. So that really demonstrated that there's a need out there. The partners want it, the patients want it and need it, and it's been effective. This is a very small sample size. For all those, academics out there, I don't want to oversell or advertise, but we did do surveys to individual families and saw a consistent 31% reduction in anxiety. And I'm going to turn it over to Bernie, who's going to talk a little bit about, he's a founding board member, and he's going to talk a little bit about this project, his role as a leader of our program committee and longtime board member, about play and what we do. And I'll turn it over to him.
So thank you very much, Whitney. And I must say, I'm really very happy to be here today. So and this has been a wonderful introduction that Whitney just keyed us up on. And that'll help move us forward in the discussion we're going to have. Let me just say we're extremely comfortable with the science and the data that inform us that play is critical, really another tool for child development, and especially so for those experiencing physical or mental challenges and also chronic illnesses. So it's not a matter of just the acute issue that a patient may have. It's the chronicity that also helps us knowing exactly what we would like to do. The approach to quality and performance improvement would ask what measures, what metrics we have used to assess improvement. And what does the data show related to those metrics? So we've tried to develop measures that matter, which is the terminology we often use in the quality world, measures that matter. And Project Sunshine has been charting process measures, such as the number of partners and volunteers and children and families served, really the percent of people served. This gave us information about the growth of the programs and also the assumption that that equated with satisfaction. It doesn't tell us that exactly, but it does help us understand that it does equate to a good degree with satisfaction. However, TelePlay, and I must say that TelePlay is still in its infancy, even though, as Whitney just said, we're about, hard to believe, close to 2 years in its origin. But it did advance our thinking to further evaluate how the children and families served were satisfied with the program. And that is patient and family satisfaction. So we began to look at outcomes and be able to equate outcomes with the work that we're doing. So that's metrics that really matter, patient and family satisfaction. As you know, we use that in the hospital setting all the time. To follow through, approximately a year ago, understanding that play can both be fun and therapeutic. And I think all of us, if we go back to our childhood days, we recognize it was always fun, never realized that it was therapeutic, but indeed it always was. We decided to evaluate the relationship between teleplay and anxiety reduction using a survey process to obtain the data and inform us further. We really wanted more data and really see exactly what we were accomplishing. Outcome measures, as we know, reflect the impact of the healthcare service, in this instance, Project Sunshine, or intervention on the health status of the patient. And in this instance, we're now talking about anxiety reduction. So 2 surveys were instituted. The first was a post-participation survey that requested information from caregivers about their child's anxiety level, both before and after the teleplay session. And secondly, a quarterly observation survey. This was a request to our partners that asked similar questions about anxiety, but posed as an observation for all of the children that attended their facilities' teleplay sessions. So therefore, the denominator now was considerably increased. So let's review some of that data and some of those results. And I'll pass it along to Kira, and Kira will tell us exactly a little bit more about what I was trying to bring to the attention of everybody listening. Kira?
Thanks so much, Bernie. So yeah, while these results are preliminary, we're really excited about them. Like Whitney said, the sample size is something we're trying to grow over time, but starting with these caregiver results, the data from the 61 caregivers who completed the survey show that we're seeing an increase in the number of caregivers reporting no anxiety after a teleplay session. As you can see here, the jump from 45% to 81% of the caregivers reporting no anxiety. And so we're also seeing promising changes in the other categories of reported anxiety, such as mild anxiety after a teleplay session, dropping from 35% down to 7% here. And so like Bernie said, these are the results coming from caregivers who are telling us how their children responded to teleplay. But then on the next slide, we also wanted to kind of hear from those partners. So whether it's the child life specialists at a facility, social workers, or leaders at nonprofit organizations we partner with, we wanted to see what they were seeing among the children that they're working with as well. So they reported similar results to the caregivers who we surveyed. So out of the 51 partners we surveyed, we were seeing similar increases in the areas of partners reporting no anxiety, 39% to 92% here, as well as the similar changes in other categories such as mild anxiety dropping from 53% to 8%. And so as you can see, these results so far are promising and exciting. And using this data, we were actually able to perform a paired t-test since we had both of the before and after data. And from that, we were able to conclude the number that Whitney presented earlier, which is that teleplay participants were noted by their caregivers to experience on average a 31% reduction in anxiety after completing a teleplay session. And so while the survey sizes are still small, we have big plans to test our hypothesis further with more support and better technologies. So with this, I'll pass it back over to Whitney to share how teleplay has impacted our reach overall.
Sure. And I want to be clear that I feel that I might have missed this in my introduction, that exactly what teleplay is. It is live video conferencing with background checked volunteers and a small group of patients. So I just want to be, I feel like I should have been more clear for our new friends out there. So Meg is going to go, it has a sample of a session and we'll go really into that, but it is live play and activities. And we, in a literature review that we've developed, we're the only ones we've found through a third party that we're the only organization, we're the only ones doing this kind of work. There's folks who are streaming things, but the interaction is essential and important to us. So what have we learned over the last several years? Well, we've learned that there's lots of different places to expand our mission and ways to expand our mission, which is that live connection and play and activity. But this, as we were developing this program, it made us think about who we're not serving when we are only place-based, when we are only in hospitals. And of course, the healthcare trends indicate that children and adults are spending less time in hospitals and more time recovering at home. And the pandemic has really spiked the growth in telehealth users and video conference users. I don't think we would have had this meeting necessarily in the same way in 2018 or 2019. Maybe not. So we've been thinking about expanding our reach because we have been developing this video conferencing and it's met with some success, and we've had the reduction of anxiety and we've had users on it. So it made us think about who needs us. So Kira, if you don't mind going to the next slide, we have our population of about 1.3 million American children who visit the hospital every year. That excludes neonatal. It is not totally apples to apples here. We're aware of that. Healthcare data is really challenging. I'm sure I'm preaching to the choir. And we're not, fully experts on analyzing this data. We would love help, but 1.3 million, excluding neonatal in the hospital. And that's really from 1 year up to 18. The next yellow circle is that we estimate there to be 15 million children between the ages of 6 and 17. And we're looking at 6, we're looking at 5 or 6, but the data is telling us 6. Because that's at an age that you can use a device, getting on an iPad or something, or a computer or something like that. 15 million children who are living with a chronic illness in the US. That excludes learning disabilities and ADD. So that includes approximately 3.8 million children with asthma, 2.9 children with developmental delays, 1.4 million with autism. You get the idea. So that is a huge group of children who could benefit from teleplay, video conferencing, play and activities. And we want to serve them, but we can't do that now at this point. We want to serve both the children who are in the hospital at the 1.3. We want to continue with what we're doing, continue with the in-person activity kits, and then reach also those additional children who are the 15 million who are living with a chronic or complex illness. In a survey that was conducted by the UK charity Young Minds, 83%, this was early in the pandemic, but 83% of young people with a pre-existing mental health need reported that the pandemic made it worse on their mental health to some degree. So this is a problem, obviously, that we are facing, and that lots of agencies, including the AAP and the American Academy of Psychiatric and Mental Health and others are alerting us to. So I'm going to hand you over to Meg Kellett, our child life specialist and director of pediatric experience, who's going to tell you a little bit about one of our users, one of our patients, so that you can understand her story.
Thanks, Whitney. So let's dive into a real patient that we've been able to reach. So this patient is real, but we have changed her name to protect her privacy. So Margaret is 15 years old. She is a cancer patient on the West Coast who is frequently hospitalized. She has turned down many opportunities from hospital staff to play in person, but she decided to try teleplay. And in the beginning, she kept her video off. It took her a while to turn her video on, but slowly but surely she did. And now teleplay at home is something that she looks forward to. And one day on the unit, Margaret's child life specialist was found by her mother, and she wanted to specifically track her down to tell her that teleplay is the one thing that Margaret looks forward to, and just how integral it is in her healing process. Now, I want to talk to you a little bit too about not only the connections that she makes with other children and volunteers on the session, but about the importance of control. You know, children that are sick do not have control. They don't have control over the medical procedures that they receive. They don't have control over their length of stay. But in our play, we try to give them a little bit of that sense of control back. So what game do you want to play? What color do you want to use? Do you want to keep your video on or off? This game category or that? So let's dive into now just a quick look at a real session so that you can see what it looks like live for our families. So just a quick look. These patients are consented to see.
Okay, do we have everyone? Okay, I want to start with Mabel because I need to know what you're holding. Oh, turn your mute off, Mabel. Hold on, maybe I can do it for you.
It's my guinea pig.
Wow, does your guinea pig have a name?
Yeah, it's named Dusty.
Dusty. Wow, I love your guinea. Does anybody else have a guinea pig?
Yeah, I have a
Is
guinea
that
pig.
your guinea pig?
Cause
Well, I can get the other guinea pig too. They're sure guinea pigs. This is Whiskers.
Whiskers.
So
Hello,
cute.
Whiskers. You have 2 guinea pigs, Henry?
Yeah, me and Mabel have the same one. So.
Wow. So cool. Henry P, what did you bring?
I bring an iPad and it makes noise.
Very cool. Angie, what did you bring?
Well, I didn't find much, but I knew that I had an Easter egg that kind of made like a shaky noise.
Okay. Yeah, that makes sense.
Yeah.
Who are we missing? Oliver.
Wait.
What is it? Is it a necklace?
No, I already said it.
What are you holding?
I'm holding a necklace for the second round because I find something that was round.
Oh my goodness. What'd you bring for the noise though?
Me.
You make noise? Okay, that's true.
All right, so Oliver is a clever one, right? But like Margaret and many other children across the country, they have a critical need for connection. And our sessions are inclusive of the entire family, and siblings are encouraged to join. Now, connection for kids and adults takes time, and TelePlay lets children engage on their own terms. And we've learned that not everyone feels up to playing in person or even turning their camera on, but that connection is valuable. We have heard this from our patients 15 years ago to patients last week. And they want more control over when they're going to see Project Sunshine next, and TelePlay helps increase that control. They know when the next session is, and they can look forward to it, just as Margaret did. Now, Project Sunshine's programming benefits siblings, caregivers, healthcare staff, and provides connection between children and volunteers. Every person surrounding the sick child has support needs. And when a child is engaged and getting support outside of the circle that they lean on, it relieves the micro community and strengthens the support of the child. We see this direction for Project Sunshine as providing more access and more equity. You don't need to be in a hospital bed at the exact same time that a volunteer comes to the hospital to experience that connection. You can be in a rural, pre-op, or post-operative setting, and all you need is a smart device, and you're welcome into our community and our activities. And lots of kids like Margaret who are at home may never get the chance to experience Project Sunshine programming. These children can feel anxious, depressed, isolated, and as the team alerted to before, mental health is a youth national emergency. We want to give every child who visits a hospital or who is coping at home access to Project Sunshine services. And we are in the perfect position to help and to grow. And as Whitney mentioned, after an extensive review, we are the only organization doing this work, and engaging our volunteers over all aspects of our programming continues to remain unique. But of course, it requires people and technology and ambitious goals, and I'll let Whitney tell you more about that now.
Great. Thanks. So I'm going to speed through this so that we have plenty of time. So we'll go to the next slide. But we have designed a 5-year plan that really focuses on growing all of our programs, but TelePlay is the engine for that growth. So because it's a technology, and as we all know how much, how technology, once you build it and invest in it, really can spark that reach and that growth. So we want to grow all 3 of our programs, which we see as equally important and interdependent. And in the next 5 years, we'd like to go from serving 200,000 children pre-pandemic. We need to regain some of that ground, and then reach 500,000 children per year. And so that's a significant effort and growth for us. So how are we going to do it? Well, before I talk about all sorts of numbers, et cetera, we are really in it for the impact. We don't want to do more just for the sake of doing more. It's not about volume. It's about connectivity between children and others that is not possible today. And we want deeper connection with volunteers and patients and children with each other. The magic of our mission and what we, the Project Sunshine ethos isn't in the stuff. It isn't in like what it's fun and it's great to expose children to arts and other games, but it goes beyond that. The activities are a vehicle to connection, and that play is what brings children to the table. And at the heart of our DNA is the connection. But as Meg said, something that we've heard from patients is that they want more. They want to continue the relationship. They want to know the next time is coming. And historically, we had very little continuity between visits. So our plan is not just about serving more patients, it's about incorporating play and service into the lives of patients like Margaret, being a constant so that Margaret can get comfortable, turn on her video, and then join. And so if you meet Project Sunshine in a hospital, you'll be able to continue your access at home. We see a world where children can follow a volunteer to the next session, or connect with a community of a rare disease that only they have, and maybe several thousand or 10,000 others. We also see this as a vehicle potentially for nurses and social workers to have play bring children to the table so they maybe can follow up with their patients, have a window into their homes, and continue their treatment. We do not provide the treatment. We're very clear about that, but we do partner with people who do. So over 2021, we were very disciplined in our planning. And I'll take you a little bit through how we've done this. Kira, if you don't mind going to, thank you. We were very fortunate to have some wise and experienced people on a committee, a task force that we created called the Impact Task Force, that reported up to Bernie's committee. They developed a measurement framework with us. We did a literature review that I mentioned. Our friends at Salesforce, we have a great partnership with them, has helped us with technology piece and guided us on some important choices. We reviewed 250 different technology platforms in October, and we have identified a path, one sort of singular path for us. So we are taking this very seriously. We are working very methodically around this. And during this whole time, we've been doing the program. It hasn't been the absolute best user experience, and that's why we want to really find the right technology for us. But nevertheless, we have served over 3,000 children and families. So I think that, that is important. We've learned a lot. In conclusion, as we sort of bring this home, we really see all of our programs working together, and our volunteers working together in support of patients like Margaret, who's at the center of this universe, and improve our continuum of service delivery for her and for other children who would benefit from play. So beyond the numbers and the reach, which is important, we want to change lives. And I think that's why we're all here. That's why you're part of an academic institution. That's why you're part of a nonprofit. You want to make an impact, and we want to change lives. And so we really envision giving young people more control of those who are coping with illness, and more access to play and connection. All you need is a smartphone or a device. And the US Census in 21 identified that about 83% of Americans have a smartphone and 72% have a laptop. So Kira will go to the next one. So when Margaret was introduced to TelePlay and continued at home, we see her, continuing to be part of the community, and that's what we're building. We want to engage outside of the child life community, who are our main contacts right now, and deepen our network into social work and nursing, as I mentioned. But as you all know, the model of health, this is why there is a digital health center, the model of healthcare is changing, and we need to adapt to it. So this is our version of our organization adapting. So now we'll go to the discussion, transition to the discussion portion, which is, and we want to put it out there, we want to partner with researchers to help us demonstrate that teleplay is effective, and we want your thoughts to help make it even better. We know there's lots that we can do. And we'd be interested in exploring like user demographic benefits the most and what works the most. Maybe there's, there's things that volunteers do that we can study and make sure that and translate that to our next generation of volunteers. So that's why we're here, and we'd love to have you help bring the healing power play to what will be over 1.5 million children over the next 5 years, and then even beyond. So thank you.
Thank you so much for that great presentation and for sharing with us the impact that you've noticed with TelePlay over the last couple of years now. This is the point where we're going to open it up to our audience to ask questions, share thoughts or feedback or ideas based on the questions that Project Sunshine is proposing. So I'll invite folks to raise their virtual hands. We can call on you and you can unmute yourselves. If you're in a place where you cannot unmute, please feel free to chat your questions or thoughts into the chat function. But we're excited to invite folks to discuss. Go ahead, Amira.
Hi. I'm curious about some of those last statistics that you mentioned about how many people in the US have a smartphone, because obviously so many do, but I'd assume that statistic probably isn't super uniform across different demographics. And I'm curious how your program is working to address those inequities and get to the kiddos who may not have such easy access to smart devices.
Yeah, it's a great question, Amira. In terms of sort of the quality of the data, I don't know. It's from the census. I'm sure that there's lots of challenges with access to the census and who fills out what, but it's sort of what we have to go on. We are a small but mighty nonprofit. I would love to take on the broadband and technology access, but we can't right at this stage. And so we are very open to partnering with organizations that do focus on that. Like if we don't sort of stay at what we're good at, we won't be effective. So we have found that, what we're building is software that can be accessed on any hard device. But we can't solve right now the technology problem or the broadband access problem. That said, hospitals that we're working with do have and we're working with a lot of hospitals right now. We are looking to go into more nonprofit organizations. We have a partnership with Juvenile Diabetes Research Foundation, but hospitals have been working with us on solving that hardware problem. And they do typically have Wi-Fi that's available to guests, but it's an issue. It really is an issue, but it's not one that we can totally tackle in this first phase.
Thank you.
I see we have a chat came in from Adam. Thank you for this talk. This might have been mentioned, but if you could talk a little bit more about, did you notice a difference in efficacy in anxiety reduction when you compared in-person to telehealth programming?
Well, I'll turn to Bernie and Kira for that, but I will say that, one of the things that we were not as able to do when we were solely place-based and in person was to do this kind of measurement. Because we are partners with hospitals and we are guests in many ways. I mean, full partners and welcome guests, but guests on the scene at the hospital. It was an incredibly bureaucratic process that we started and then did not finish because it was really, really hard with the decentralization of our systems in American medicine. Getting patient consent and doing surveys from patients was not something that hospitals were really ready to take on with us. But having this direct to patient communication meant that a whole new world of evaluation opened up. Bernie, do you have any other?
I don't think we have the data right now to answer that question accurately. Obviously, it is a very important data, not only for Project Sunshine, but for everybody who is doing virtual kind of work. We really don't know the difference right now between the outcomes from virtual versus in-person meetings of all kinds, specifically when it comes to healthcare. It is something that will be measured, is being measured, and the outcome results will be important for everybody to evaluate. But the new normal is going to be virtual visits. There's no question about that. And in terms of the ability of those virtual visits to enable communication and coordination of care, which in many instances doesn't happen, even in disadvantaged and populations, which clearly was demonstrated during the COVID epidemic. And so we know that there is value to the virtual meetings for sure, and it's being done by everybody. It is the new normal. The question is, what is the data going to show down the line about the importance of what you've just raised in this discussion?
All right, we have no other chats coming in. Is there someone with any burning questions still? Or I mean, I can open this up as well to Project Sunshine if you all have questions for the audience, maybe some targeted feedback and interest. Or I am seeing some chats now. Another question, I noticed that there were no changes in participant-reported moderate or severe anxiety symptoms, despite a significant reduction in mild anxiety symptoms. If the children endorse persistent anxiety after the program, is there a way to help get them resources?
That's a great question. Meg, do you want to?
Yeah, that is a great question, and something that I think, the team would be interested in sort of exploring what that may look like for best practices. I mean, this is new to us in collecting this data, and we want to do it mindfully, we want to do it thoughtfully. And I think you raise a really interesting point, is what are the next steps once we get the data, once we identify it. So I think that's something that we'll take back and explore with our teams.
Yeah.
I mean, we'll probably have to we will bring in community services once we have the opportunity to understand the data a little bit further. Community services will be extremely important in some of the issues that will be raised, specifically when it comes to anxiety and depression. And so once this is identified, we will try to link that with services necessary. The point being brought up before about certain communities, we realize that the zip code is more important than the genetic code in many instances. And so we're trying to tie the work we will do with community service. And it is in our thinking to allow that to happen sooner rather than later.
We have a new question in the chat from Julia. This could have been discussed earlier, but have you considered exploring or implementing this kind of program for terminal elderly patients in delirium? Perhaps they're seeing some connections between the type of care provided in child care versus in elder care, expansion of these services.
Yeah, we haven't, because we really want to get this right. And our mission for the last 20 plus years has really been to focus on children. And so, we want to do the best we can on what we're focused on. But if there's folks out there who have an interest in transferring this to different communities, we want to help, and we are very happy to be transparent, share what we've learned, explain what, the mistakes we've made or the opportunities that we see, and would be, very happy to just share the knowledge and help.
Other questions from our audience members?
So Allison, I have a question for the group, and no, people don't need to say anything or respond now, but if there are folks out there who are interested in anything or doing work that may overlap with the work that we're doing, that they just want to make us aware of, whether it's research points that that would help us or are adjacent to anxiety and children and play and recovery, we'd love to hear them, and we'd love to get to know more people. We are a volunteer organization, so we're good at bringing new people into the mission and having them find a role and a piece. We have volunteer opportunities, we have committees. So I just sort of put that out there. You can message us, you can put it in the chat, you can follow up with Allison, and we can start a conversation offline.
Yeah, absolutely. We will follow up from this with the link to the recording, as well as a way to get in touch if you have follow-up interest, questions, comments. I see another question came in through the chat from Brittany. In creating TelePlay, how did you determine which activities could best be executed in a virtual environment?
That's a great question. Yeah. So we use, I have a background in child development. Some of my predecessors and colleagues and collaborators also have a background in child development. So our ethos as child life specialists is really about play. And so, we obviously had to pivot the play that we were doing in hospital to a virtual setting, which we recognize is different. So we had to really touch in and focus in on ways to engage communities with different adaptation needs, with different, sensitivities based on their developmental age or ability. And so we have broken down our games developmentally to adhere to those different developmental needs. We have added sound clips. We have added, engaging animations. We have used multimedia to really just grab people's attentions. And I would say we also try to keep our activities to a 20 to 30 minute time span. For our friends that are, our participants that are joining from a hospital setting who are maybe in pain or uncomfortable, 20 minutes is a good amount of time to engage. It just gives you just the right amount to connect with another child and to maybe move on. Or if you want to play 2 games within an hour session, you're getting that need fixed. So we really also lean on our partners for feedback. We are constantly meeting with them to hear about what's working, what's not. Our anxiety reports have been really helpful in sort of testing the level of engagement from our families. So we're constantly adapting, but I'd say overall, we're trying to create as diverse of a set of activities for the families that join, because they just come from a variety of backgrounds, variety of needs, variety of medical challenges.
I have a question, actually, if it's all right. I know I'm moderating, but I think this kind of jogged some thoughts for me about you had referenced exploring new technologies as you're growing this program, and I'm curious to hear a little bit about the elements that you are considering adjusting with new technology, how those decisions are being made, and if there's an evaluation process that you're planning with those components.
So I don't know if I'm going to answer your question correctly, Allison, or what you're looking for. So stop me and I'll tell you, when I started this role 3 years ago, I did not expect that we would be building a whole new technology platform. So we've been able to surround ourselves with people who really care about the mission and know how to do this. So what we'll be doing this year is really developing what we call a minimal viable product, an MVP, which was a new phrase to me, maybe not to some, hopefully not to some people on this call. And we did a visioning exercise with caregivers, with former patients who are now adults, with volunteers, with folks who work at hospitals and nonprofits, to really understand what is it that they are needing and wanting out of their experience on TelePlay. And it was through that visioning exercise that was led by Salesforce user experience. And so they were able to, lean on, help us really imagine that we did this sort of half-day session and then captured their interests and needs and really memorialized it. And now, as we're working with different companies, we are sort of sending out these requirements, which include things like the ability to turn on and off your video. It's a must-have, right? The HIPAA compliance around data, must-have. The idea of volunteers being able to have control so that they can exit people from sessions if, we get someone who's not, an inappropriate, person in the session. Different languages, right? We want to build that in now so that we can create access later. So it's decisions like that that have been informed by all of our different stakeholders and that are going into our MVP, because right now we're working, I sort of say this with tongue in cheek, but it's a little bit, this is a grand experiment that is now worth the investment. We've made the case and we have seen it because we've been able to serve people and reduce anxiety, but it's made out of Scotch tape and paper clips. It has a HIPAA-compliant Zoom account, a pretty clumsy way of registering. So it's not like you can pick up your iPhone and schedule it and get on. It takes a little bit more commitment. And we're really grateful to all of our partners out there who are going the extra mile and getting their patients on and really and working with the volunteers.
I think you did achieve answering my question, so thank you for that. I'm also curious, just in the interest of all of these new evaluations that you're trying to pull together for TelePlay, if that is a component you're hoping to build into this new system, being able to evaluate anxiety levels or things through the tool itself.
Yes, definitely. And we actually feel like now that when we create the MVP, we'll be able to survey caregivers, but we're actually going to explore surveying the children, the participants themselves throughout the session to see if their reported anxiety is matching partners and caregivers evaluations as well, so that we can really sort of look at the efficacy of the program and make any changes or pivots that we need to do while they're playing and engaging with the technology.
Yeah, and if I could just add on, we're kind of looking at the current survey where we have it pop up at the end of once the Zoom closes, a caregiver could fill out, oh, what did you think how did you think your child was feeling in terms of anxiety before and then after, and that's where a lot of that data comes from. But we're looking in the MVP and things like that to see, can we ask a child to pick how they're feeling on a smiley face scale, like kind of from the sad face to happy face, and see how that works, just kind of working through that and seeing what makes sense to ask a child, how we can use that to improve the program and things like that.
I want to assure everybody that valid metrics are really an important part of this program. And we'll have to reassess periodically as we look at the data to be sure that the metrics are valid. And if we have to make changes in those, we're okay with that. So this will be a process. And I think we'll get to what we're confident in will be valid metrics for all to look at and be comfortable with.
Thank you. It sounds like there's a lot of opportunity, especially moving into a digital space, to expand the evaluation methodology, especially since, as you had mentioned, working in person doesn't really have the same kind of opportunities there. So I think this is a great opportunity for folks with that research background, with that experience of moving something into a digital space and evaluating the efficacy of that. I think this could be a great opportunity for partnership. And I think we hope folks will consider reaching out after this session today. I want to leave space for any final lingering questions before wrapping up today. But if we do have an extra 5 minutes for folks to take a break between the many Zoom calls, I'm happy to do that as well. In the meantime, I'm going to chat a few links to the group. The first one, if you would like updates on our seminar series, on the things that the Center for Digital Health is getting into, please sign up for that listserv. That's that first link there. We also have a survey to help us improve these seminar experiences for everyone in attendance. We'd love for you to fill that out for us. And then the last piece is a link to our upcoming seminar. So any future sessions will be posted on that page. And so we invite you to come back. We have a variety of interesting conversations. I think, in fact, just Kira, as you were talking about rating things with smiley faces, I was thinking back to our previous seminar, which was about emoji for the medical community. And so things are always connected. It's interesting to attend all of these different seminars with people who are working in such interesting new spaces. So With that, I want to say thank you to our panel of speakers, to Project Sunshine for coming to the session today, and to our audience for engaging, for being here. We will send out the recording after today's session ends, and we hope you all have a great rest of your day. Enjoy the extra few minutes.
Thanks, Allison.
Thanks
Thank
very
you,
much.
everyone.
Thank you, everyone.
Thank you.